Welcome everybody. Good afternoon. My name is Marco Landi and I'm the president of the Council of European Dentists, a European umbrella association representing dentists from 31 European countries. It is a pleasure to be introducing the third debate on interprofessional education and training, promoting One Health in professional practice. I'm happy to see that after two successful editions of the One Health initiative in Paris and Warsaw, we can hold this third round of debate in a virtual format. The past year was a very challenging one, the pandemic disrupting every aspect of our work. However, one of the lessons learned is that there are multiple urgent matters that should not be neglected. One Health is one of them. Today, a panel of experts, together with the participants, will reflect on the value of One Health interprofessional training in enhancing health crisis preparedness and management by sharing experiences from human healthcare and veterinary practice. The discussion will be linked to the ongoing European Health Union package for the prevention, preparedness, and control of serious cross-border health threats in the EU, such as pandemics and antimicrobial resistance. The last two editions' main takeaway messages were that One Health is a concept to be integrated in the teaching of all subjects, clinical and non-clinical, in medical, dental, pharmaceutical, and veterinary curricula. Moreover, One Health requires the sharing of knowledge and experiences through interprofessional collaboration. Therefore, One Health education is about learning together, not adding a new subject. The 2020 experience only confirmed that cross-sectoral collaboration between doctors, pharmacists, veterinarians, and dentists is needed in order to appropriately tackle global challenges. Dentists recognize the growing urgency to design and implement programs, policies, legislation, and research in which multiple sectors communicate and work together to achieve better public health outcomes. In order to address the increasing cross-border threats to health, the development of a framework for an interdisciplinary intervention approach through collaboration is necessary. Today, all of our organizations keep the promise to continue the debate, and we hope it will generate interest that then will be translated into a real change in the education and training of our professions and practice collaboration. I look forward to a fruitful discussion, and I encourage you to participate in these exciting sessions. Thank you. And now it is my pleasure to give the floor to Despina Iatridou, Senior Policy Officers of FVE. Please, Despina.
Thank you very much, Dr. Landi. I'm trying to share my screen for a short presentation. And okay. Normally it should work. Is it okay?
Yes.
Okay, perfect. So thank you very much once again for the introduction, and good afternoon to all the participants that joined us today. It is already four years since health professions in Europe recognized that success of the implementation of One Health concept in medical and veterinary practice passed through medical and veterinary education. All of us committed then to exploring One Health interdisciplinary education as a tool to foster collaboration of professionals and future professionals. The journey started in 2017 with a joint letter sent to all the deans of all medical, dental, and veterinary education establishments in Europe, calling on academics to embrace One Health culture in education provided by their establishments. This first initiative was followed by two very successful regional debates, one in Paris and one in Warsaw, where discussions highlighted that One Health is based on the interdisciplinary collaboration between many different professionals who need to be educated to respect and to seek the close collaboration with each other. It was also acknowledged that professionals at the moment learn to practice in isolation, and the conclusion was that there is a need for promoting interdisciplinary collaboration by promoting interdisciplinary education at university. The idea looked brilliant. Everyone agreed with that approach, but how ready was academia to implement such a model of education? In 2018, the Veterinary School of Ghent, in collaboration with the Veterinary School of Lugo in Spain, launched a project to explore the implementation of One Health interdisciplinary teaching in veterinary education establishments in Europe. A questionnaire was circulated to all 77 veterinary schools in European Union and the European Free Trade Area. 41 of them from different regions of Europe returned the questionnaire. The results showed that in 2018, 13 of the 41 veterinary schools integrated interdisciplinary training in their undergraduate curricula. 14 did not implement it yet, but plan to do so in the near future, and 14 of them did not implement it and did not consider it at that moment. Most of the 13 veterinary schools organized joint undergraduate courses in collaboration with basic sciences and medical schools. Less do so with pharmacology and social sciences, few with environmental, agricultural, or public health institutes, but none with dental schools then. On this table, each row represents a reply from one school. What we observe is that 4 schools collaborated with more than 2 other education establishments. Joint teaching was integrated in the core curriculum by most of the schools. Only 3 of the 13 veterinary schools provided joint training opportunities to their students throughout the whole undergraduate curriculum. 4 of them provided only in the first years, 2 in the middle, and 2 in the last years of the studies. Joint classes organized at the first years of the curriculum were the most multidisciplinary, bringing together students of medical, veterinary, biological, and natural sciences. Joint teaching was implemented in core subjects such as basic sciences, anatomy, and ethics, or in electives such as language classes, informatics, and others. Joint classes organized in the following years bring together mainly health students. In the core subjects, such as pharmacology, food hygiene, or public health and antimicrobial resistance. All schools were asked to indicate the hurdles they face towards implementation of such a teaching model, and the responses we got were similar, irrespective of whether the school implements or not joint teaching. Most schools indicated legal and university regulations as the most reported obstacles. Reluctance of academics and students were also reported, along with other hindering causes. For example, the tight curricula, lack of appropriate policy provisions, strict hierarchy, and also making the teaching fit for purpose for a multidisciplinary audience. Another part of the mission of the veterinary academic establishments is to provide training for continuous professional development. 27 of the 41 schools indicated that they provided joint postgraduate training in the form of One Health summer classes, master programs, or PhD programs. Most of the veterinary schools organize joint courses postgraduate with medical schools. Let's do so now with basic sciences, pharmacology, and other institutes. And few, they now organize also some postgraduate courses with dental schools, as well as with social sciences. Each row on the table represents again a reply from one veterinary school. And now we observe that about half of the schools that they provide postgraduate training, they do it in collaboration with more than 2 other establishments. Veterinary schools were also asked about the hurdles they face towards implementation of postgraduate training. What was of interest is that 11 out of the 27 schools indicated that they didn't face any obstacles. The rest of the schools indicated again regulations, university structure, reluctance of academics or professionals as hindering factors in different combinations. Additional hurdles that were indicated in the comments we received was the complex administration for the students willing to register to such programs, but also difficulties for the professionals to recognize their qualifications after graduation. The competition between academic establishments was also another factor for the financial resources. And difficulties in the teaching process were also reported. Joint teaching has its own challenges in order to be fit for purpose and interesting for all the participants. Veterinary schools were asked to indicate if they see benefits from the implementation of such an approach in undergraduate and postgraduate education. 39 of the 41 schools replied to the question and consented, all of them, that this model of education is only beneficial as it helps students and professionals to develop a common understanding of One Health terminology, to better understand their role in the One Health concept, improves overall communication, expands the professional network, and thus prepare professionals to cope better with complex health problems. As a result, it is also beneficial for the society as it contributes to tackling more efficiently animal health and human health challenges. Finally, it is also beneficial for academia as it motivates academic establishments to enhance their cooperation, optimizes human and financial resources, provides opportunities to improve teaching methodologies and quality of research. The complete results of this project are published on the Journal of Veterinary Medical Education and are available for anyone interested to find more about this. To summarize, although this research provides results from only one sector, namely from veterinary education, it confirmed that the conclusions of Paris and Warsaw discussions were valid. Legislation can have an impact on integration of One Health education. One Health can improve our understanding and response to many of our current challenges. One Health interprofessional collaboration is also about learning together, as highlighted by Dr. Lanti. I'm sorry. And there is a need for continuing the work and keep promoting interdisciplinary training and collaboration. Further to this, it shows that academia tries to respond to these needs. Having the experience of a big crisis that we all faced during last year, it is time to move forward and discuss our next steps, including how legislation could promote, facilitate, and support interprofessional training. And with that, thank you for your attention. And I give the floor to Professor Monti, I think, and the next speakers to hear more from them.
Thank you very much, Despoina. This was a very interesting overview of the situation. Being a physician who worked his life at a university in Hamburg, it just dawned on me what would have been the result if we had put the same question to the medical faculties in Europe and the dental faculties. I see Marco nodding his head as well. And I just checked because I wasn't exactly sure on the figures. We have, without the private universities, we have 35 faculties of medicine in Germany and only 5 faculties of veterinary sciences. My question goes into the direction, what would happen to those 30 underprivileged medical students who do not have the chance to have a One Health approach in their training, because they simply don't have a veterinary education establishment in their sort of around their faculty or in the same city or state where they are training for medicine. Isn't that something we have to consider as well? And therefore, it might be very important to have the undergraduate training for the vets, but isn't much more focus important for have the postgraduate training for doctors, physicians and veterinaries and dentists at the same time, because we simply reach, we have a much larger outreach because there are so many people around. What do you think about this question?
First of all, thank you for these notes, very interesting remarks. And indeed, this is something that we say it would be very interesting to see, first of all, what's going on in the other sectors. That's something that would be nice to have and being able to compare results. As regards the fact of having a veterinary school and a medical school together, we should not forget that One Health, it's not about medical and veterinary education, it's much broader. And we speak about a One Health culture. We saw in these results that we have collaborations not only with medical schools, this is of course the closest links that we have, but also with other schools. I think the important is to start switching our minds, start thinking One Health, start developing a One Health culture, start developing a One Health collaboration with other professions, other students, and create those links. That is more important. And step by step, we will also recognize what are the critical points that we have to intervene and to or adapt our curriculum.
Yes, thank you very much for this question. I think you will take part in the final discussion round at the end, because I see there are questions. One was the question which I put to you, but there is another question from Andres Vázquez. We'll try to integrate that into our discussion at the end. So this now brings me to the point where I can thank Marco for his introduction to this meeting today, and where I can thank you, Despoina, for your brilliant presentation, which gave us sort of a kickoff for today's meeting. And now I have the privilege to moderate you through the remainder of the afternoon. And we have 2 important subjects on our agenda, with 2 very esteemed speakers. The first will be the lessons learned during management of a pandemic, and the second will be lessons learned from collaboration against antimicrobial resistance. If we start with the first, the management of a pandemic, of course, none of us has ever expected something could happen like the pandemic of Corona has happened to all of us. I, as president of the German Medical Association, was very much involved in the German pandemic plans of 2012 and 2018. But just to give you a very brief idea, we were totally wrong on some expectations, because, for instance, when we talked about logistics, we thought that for personal protective equipment, it would take 10 days to fly it in from Wuhan. And none of us expected that our total logistic concepts would break completely. And this was just one. It reminded me of an old saying of the German General von Clausewitz, who during Prussian times was an important person, who said, at the first touch with the enemy, all strategy is just maculatura, it's just gone. And I think that is important as an idea. And this is one of the things we have learned from the pandemic. And therefore, I think we were all very much enjoyed the speech of Ursula von der Leyen in November, when she took a little resume of the first 9 months or 6 months of the pandemic by taking some responsibility for the vaccine crisis, because we've made a mistake as European Union in the vaccine procurement, because we discussed price instead of quantity. We should have asked for every single drop of vaccine to be produced in the European Union, to be administered in the European Union as well. And I think this was one of the great problems, because whereas other countries have sufficient supplies, we have scarce supplies of vaccines in Germany. But the most important part of her speech in November was the announcement of creating a European Health Union. I think this is very important, and though some of our countries are still very reluctant to give up the concept of subsidiarity, under Article 168 of the Treaty of Lisbon, I think, however, that there are 3 very important issues in the European policy dealing also with One Health, what we are talking about today, and that is the future structure and portfolio of the ECDC, which is going to be enlarged. And I'm very happy that later on we will have Dominique Monet from ECDC also addressing us, and maybe he'll touch on that issue as well. It is the enlargement of the portfolio of the European Medicines Agency, and of course it is the equivalent to the American BARDA Institute, the HERA Institute, which is going to be introduced, which is there to detect, very early detect and respond and react to biological or other health crises, which may not even be on our minds yet, because there is only one thing for sure, and that is there are many things we don't even know we don't know them. That's one of the big issues which we're going to have to tackle in the future. So today I'm very happy that we have Paolo Melo from the Council of European Dentists, and later Luis Pedro Carmo, who is going to tell us from the Veterinary Public Health Institute from Bern, on the lessons learned during the management of a pandemic, of course, under One Health perspective. And first of all, I would like to ask Paulo Ribeiro de Melo. I'm afraid I can't introduce you in Portuguese, but I have a feeling you are the chair of the Department of Oral Public Health at the University of Porto. You were very lucky. I hope you had holidays last weekend when Chelsea and Manchester City met in Porto, because British fans can be rather challenging. But and of course, especially in dentistry, when they start fighting. No, that was a very nasty thing to say. I apologize, and just ask you, Paolo, please give us your speech on the lessons learned during the management of a pandemic.
Thank you for the introduction, Frank. Let me hear the presentation. That's and thank you for the introduction, and good afternoon to all attendants. And I am Paulo Melo, and I am a dentist, but I'm also, as Frank said, I'm a professor at the University of Porto, and in the dental faculty and the Public Health Institute. And of course, just coming on the talk, I think that dental faculties in Europe need to have a broader approach in this case for the One Health subject and include it in their curricula and their strategy, and that's something that we can talk afterwards. At the moment, I'm also, as said, a board director at the Council of European Dentists, and as Marco said, this is a non-profit association which represents over 340,000 dentists across Europe. And it's a pleasure for me to be invited to the third debate on interprofessional education and training, promoting One Health in professional practice. Today, as told, I will be speaking about the lessons I learned during the management of a pandemic and focus on the case of Portugal. Of course, this was a very challenging period that lasts for more than 1 year since the beginning of the COVID-19 pandemic. And we can assess the profound impact that the public health crisis had on all aspects of our lives. The entire health sector was disrupted by the pandemic in one way or another, and it also had a significant impact on dentistry. Therefore, the work of the Council of European Dentists focused mainly on this aspect in 2020. We had a COVID-19 section on the website with CD information where you could find some press releases and positions regarding and information regarding CD. And then we had EU information, general information about COVID, and even the national guidelines from some of the European countries. The enormous challenges that the community is still facing because of the pandemic require an effective response and a coherent and collaborative engagement by multiple stakeholders. In these circumstances, One Health is extremely relevant. It is concerned with interactions and dependencies in complex systems and promotes a sustainably oriented health approach. The concept brings together natural and social sciences and is characterized by collaboration, participation, sharing and exchange in a framework of knowledge integration in health. A first step in implementing a One Health concept is serious cross-border health threats, including pandemics, is holistic planning. So this is the first step that we should focus, is trying to have a holistic planning, and as we could see, we need to prepare this for the future. This concept is based on a systemic thinking and rapid, innovative, coordinated and collaborative approaches. The management of a crisis by engaging multiple actors from medical, dental, pharmaceutical, veterinary and other natural sciences, as well as social sciences, is paramount in order to achieve a holistic plan. An approach to cover all aspects impacted by such threats is essential. This holistic construct can be achieved by applying shared responsibility in transdisciplinary work. This key feature has the potential for innovative solutions to manage complex problems. And for example, shared responsibility is used as collaborative approach to biosecurity management across multiple stakeholders with diverse and complementary perspective, knowledge and realities. So managing a pandemic requires robust and prepared actions, a clear definition and shared understanding of the concept, including roles and responsibilities, and consistent and appropriately resourced coordination throughout the system are needed to form true and effective partnership. As we could see during this pandemic, there was some things that were prepared, but they didn't went the way that they were prepared. So we need to have a stronger preparation on this. Lastly, it's very important to identify lessons from such situations, share and learn from for the future. Previous experience are essential in the prevention, preparedness, detection, response, and recovery of such cases. When dealing with new threats, a linking of current threats and lessons learned is critical. Therefore, knowledge needs to be shared about effective treatments, disease epidemiology, including risk factors, people's reaction to measures, and effective testing protocols, among others. In a pandemic, a country is on its own has limited possibilities, particularly when dealing with a new threat and limited knowledge of its consequence and how to mitigate it. The implementation of an internal national partnership approach does not come without its challenges. Knowledge integration, and particularly the sharing of data, is impacted by political boundaries. Further, sectoral and disciplinary silos constitute an impediment to the ability of stakeholders to mount a timely and effective outbreak response. In such systems, there is potential to improve the efficiency of information flow and knowledge exchange and integration. Traditional in the various health sectors, solutions are often prescribed top-down, implying singular linear pathways in isolated aspects of health. That is something that we really need to move forward and try to find a way to work all together. However, health as agency and shared responsibility approach may be more suitable when dealing with unpredictability, uncertainty, and ambiguity. In Portugal, in the first weeks of the pandemic, a health professional task force was established by the Ministry of Health. This group was tasked to give information on how each profession was dealing and could provide national support and expert advice on development and implementation of a strategy to contain COVID-19. This is very new to everybody. We didn't know how to deal with it. We were trying to find the best solutions and try to manage the best way to skip all the problems that we were facing. The members that were part of that health professional task force were representatives of different health professions, medical doctors, dentists, pharmacists, veterinarians, public health experts, nurses, nutritionists, biologists, and psychologists. At the same time, there was a group with medical doctors, epidemiologists, and virologists that were gathering evidence on key characteristics of COVID-19. In order to manage the crisis, the task force shared knowledge about the problems that each profession was facing, while trying to find the solutions to answer to all challenges related to the professionals and to the public health. The team met every 15 days with updates and brainstorming taking place. An important remit of the team was effectively communicate the findings to the government and other stakeholders, and between themselves, of course. The requirement of a rapid response led to a broad call to action from stakeholders with various expertise to contribute, in some cases, beyond the traditional human medical disciplines. Let me say that during these meetings, I have learned a lot of different perspectives in terms of facing the COVID problems, and it was really challenging and very nice to participate on that group. If needed, the team included veterinarians with interdisciplinary expertise from human public health, agriculture, veterinary medicine, food safety, disease ecology, and One Health backgrounds. If needed, they said they would be able to provide respiratory equipment usually used for animals that could be adapted in an emergency situation. Also, nutritionists, together with veterinarians, shared their view regarding food safety and the need to check if there was no risk of infection transmission through food. Biologists were willing to participate in the laboratory tests with their expertise and the chemical products that they could share for testing the population. Participation of representatives of the government and members from different fields helped to shape a more efficient response and bridge the gap between the tight schedule that frontline healthcare workers had. Moreover, the presence of psychologists was an added value to outline the mental health impact of the pandemic and ways to mitigate this important aspect. The Portuguese case demonstrates important benefits from the use of One Health approaches in the management of COVID-19 pandemic. The sharing of resources, multidisciplinary engagement, and communication network strategies support knowledge integration and prove to be more effective response management. This is an example of an effective engagement of expertise and resources, such as labor, connectivity, and materials from a broad range of stakeholder groups. Moreover, they illustrate One Health approaches within inclusive national and local teams, including transparent use of information, multi-way dialogue, information sharing, and development of solutions through collaborative learning. In terms of lessons learned, they are listed, all of them in the screen. I will not read them all, of course, but I want to highlight that the rapid aggregation of skills applied to a single acute problem should be held as an example of how a network of experts can contribute in an efficient way towards a goal. I would like to conclude with the idea that a shared responsibility approach agreed upon during this time could support the management of any complex public health issue, such as COVID-19 pandemic, and be implemented at different levels: local, regional, national, European, and international. And this is the main lesson that we have taken from all that is happening in the last years. And I hope that we could work all together and prepare a better response for the next challenge that will for sure come out in the few years. So thank you very much for your attention.
Thank you very much, Paulo, for giving us this very comprehensive overview. And I think the conclusion of the shared responsibility is really the driving force behind the whole afternoon we have today, and behind the whole One Health concept, because this is so important that we work together. And if you work together, you cannot only share work, you also have to share responsibilities. And sometimes, especially we, the physicians, sometimes have an attitude to be very good in sharing work with others, but not good in sharing responsibilities with them. So I think we have to take that into consideration as well when we talk about these issues. Now, that was the view of the Council of European Dentists, and we'll integrate that into our discussions a little bit later. Now we come to the veterinary side, and I'm happy to have Luis Pedro Carmo from, well, I said from the Vet Suisse faculty in Bern, but he also has close ties to Porto because he graduated from the Institute of Biomedical Sciences in Porto, and he is a postgraduate at the Institute of Public Health in Veterinary Sciences at the Vet Suisse in Bern. And he's going to give us his view on the lessons learned during management of a pandemic. Luis, you have the floor.
Well, thank you very much for the kind introduction. Can you see my screen now?
Yes, but if you would do it on, yeah, now we can see, not only see your screen, but also enjoy it.
Okay, perfect. So good afternoon, everyone. Thank you very much for inviting me to participate in this discussion. I'm honored to be here and to have the opportunity to present our work on the role of the veterinary sector in the COVID-19 pandemic responses. So we started this project more than 1 year ago. You might remember when the first COVID-19 wave hit Europe, the public health sector got under immense pressure, and as that pressure mounted, we started to have some scarcity in resources. And that's when we start reading on the news about veterinarians donating ventilators or donating PPE. We also had this case of a veterinarian in the Faroe Islands that adapted his lab to test for COVID-19 in humans. And also ourselves at the Veterinary Public Health Institute, we were actually doing data analysis for the Federal Office of Public Health in Switzerland. So that made us wonder what was the contribution of the veterinary sector on a global scale, and how can we learn from it as we go on. So we developed a questionnaire with the following objectives. We wanted to document the role of the veterinary sector in the pandemic responses. We wanted to explore the roles and relationships that have been formed during the pandemic. And also we wanted to identify ways to maintain and nurture these collaborations and also build new ones to deal with future health threats. Now, I'm not, for the sake of time, I'm not going into details on the methodology, but I'm happy to answer questions during the panel discussion. But as I said, we developed a questionnaire, and at the end we obtained 1,290 answers from 113 countries that are represented here in the map. So as you can see, we had a very nice global distribution. And Germany, Brazil, India, Russia, and Nigeria were the countries from which we obtained more answers. So one of the things that we asked was the participants to answer was to name activities in which the veterinary sector was contributing to the pandemic responses in their country. So we obtained those answers as free text, and we applied some qualitative techniques, namely content analysis, to analyze the answers, and we came up with this 6 cluster of activities that I will go now into detail. So one of the veterinary contributions related to the materials. So to the donation and lending of PPE, ventilators, surgical equipment, but also laboratory materials, laboratory facilities. Also with respect to pharmaceuticals and disinfectants, it was not only about borrowing the materials, but actually veterinarians were also involved in the production of these substances. And finally, we also had some examples of facilities, namely from veterinary faculties that were borrowed to create quarantine centers. This, of course, also created a bit of a burden in the veterinary sector, as we had to adapt our activities so that we could save supplies for human healthcare. One of the examples was the ivermectin. There was a time where we were not sure if ivermectin could be used for the treatment of COVID-19, and some countries implemented a withdrawal of this substance for the veterinary sector so that we could build up stocks. But the veterinary sector was also involved in the diagnosis, not only in testing animals, but also in testing humans. And also not only in the analysis of the samples, but also in participating in the sampling procedures. We also had veterinarians involved in the quality assurance processes, in the assessment and validation of tests. And at the time when we sent out this questionnaire, we were still trying to develop faster tests. And we had also veterinarians involved in the development of the serological tests. So another activity in which veterinarians were heavily involved was the communication and education. And I think here we could really take advantage of the close contacts and the relationship that we have with the public, and the trust that the clients have in their veterinarians to try and raise public awareness, not only about risk communication related to pets or risk communication related to animal products, but also in terms of prevention measures, use of masks, washing hands, disinfection, and so on. Our sector was also involved in many professional and scientific communications, as well as in workforce training in various aspects, but especially in outbreak investigation, contingency planning, risk assessments, as these are topics that are within our field of expertise. In terms of research and expertise, veterinarians were involved in many fields, from epidemiology to risk assessment, infectious diseases. And as I say here, it's not only about producing research, but also the expertise. And by expertise, I mean collaborating in task force, workforces, committees, and so on. And I'm quite happy to see that the social sciences also popped up in there, because I think it's often a neglected field, but I think it can play a major role in health sciences, especially when we try to have a more systemic and holistic approach, like is suggested by the One Health concept. So in terms of animal health action, as you know, various countries named veterinarians as essential workers. So there was a need to maintain a certain standard of animal health. And of course, something very important that a very important contribution was the maintenance of the food production chain. So maintaining food security. Also, in terms of animal health surveillance, especially in the beginning of the pandemic, where we're not sure about the role of pets, but also in the surveillance of other species like wildlife, and also later on of mink. As you see, we have here also an example of a quote from an outbreak investigation in mink farms, which obviously fell under the responsibility of the veterinarians. Then we have this group on public health action, and this represents more direct contributions to the public health response. And here we had veterinarians that helped in, that provided workforce support in epidemiology, laboratory work, but also in clinical environments. We also have veterinarians helping in call centers or doing contact tracing. And also several veterinarians, or the vet sector, was involved in the developing and implementation of control measures. For instance, in restaurants, how which measures to put in place, and also how to control them. We did have some examples of veterinarians that work in the public health sector, and that were contributing to outbreak investigations, risk assessment, surveillance, among others. So another question that we had in our questionnaire was how can we improve collaboration between the sectors? And you can see here already from this word cloud then that One Health was highly advocated. So we did the same. We took the same approach, and we did a content analysis, and these are the main clusters of topics that that we found that need to be changed or need to be adopted, so that we can improve collaboration between the fields. I'm not, for the sake of time, I'm not going into detail on these topics right now, but I hope that we can come back later during the panel discussion. And one of them was indeed education, intersectoral education. So as a conclusion, I must say that these are preliminary findings, but it seemed that there was wide intersectoral collaboration during the pandemic responses. There were new collaborations emerging. A very important conclusion was that we need to strengthen these collaborations during peacetime and not try to build them in a rushed way during a pandemic response, as we can build a much more sustainable relationship during peacetime. And lastly, the One Health concept or integrated approaches to health were widely advocated by our respondents. And I just want to, as last word, I'd like to thank to all participants and also the institutions that helped us disseminating the questionnaire. This was really a true global effort. And thank you very much.
Well, Luis, thank you very much for your presentation. It's very interesting. I very much enjoyed the mentioning of peacetime, because this is sometimes so important, and we sometimes have to consider discussion and cooperation and collaboration when there is no problem or no really worldwide catastrophe waiting for us. But this is exactly what we are doing. And when we had the discussion in Paris and in Warsaw, that was still tremendous peace and was great time. And I think it's good that we have these discussions. Now I see no questions in the frequently asked questions section. So I would like to thank both of you and just ask if you had a wish free, and knowing that the next pandemic, which will also probably be have some sort of relation from animal to man as the last had, if you had a wish free, both of you, Paolo and Luis, a wish free to our academic community, what would you say would be the most important thing we have to look into, and maybe make it a topic of the fourth academic dialogue on One Health initiatives? Paolo, what do you think would be the most important issue?
Sorry, there was an interference during your question, but I believe that well, if we have to face another challenge as this one, or with the same source, let's say animal and human risks, I believe that that with all the knowledge that is already we should be discussing how to prepare and how to have everything settled to respond to that kind of risk. Of course, this is a very complex question, or a very complex situation that we usually will not be sufficiently prepared to answer when it comes. But I think that now with this additional experience, and I can say that the veterinarians has a good experience on dealing with some challenges within the animals, and so they can help in preparing a response that must be taking in account not only the different areas of human health and animal health, but also include the environment and the industry, because this is not something that we can, because this, first of all, this is public health, and public health is a wider theme that needs to merge many more different disciplines rather than this health sector, and that's the reason why this should be thought and this should be prepared together with all these stakeholders and try to find the best option to answer for instance, in the shortage of PPE, or the problems on food supplies, and many, and of course the environment and all that has together with these challenges. So I think this is something that everybody needs to settle down, think a little bit of what happened, and see that this is not something that we can solve by ourselves, but that should be done with many stakeholders and all thinking in the same way, trying to find the best answer for the next challenge. That's my idea.
Yes, your pledge, really, and I think very important. You mentioned environmental issues, because that is indeed a big question. It's a question in all issues we discuss these days. But of course, as we all know, the closer man and animal get under environmental pressure, also, as we've seen probably in Asia, in some areas of Asia, the more often we will have contacts between man and animals, and the more often we will have the sort of the problem that the barrier between the species is broken by some sort of agents. And I think this is also an environmental issue which we sometimes tend to forget. Thank you very much. Luis, your pledge, your wish would be?
Well, I think what Paulo said is really important, and the part of the preparedness, and really trying to take some lessons from this pandemic as we move forward is one of the critical points. The other one is really to start thinking of health of the entire system. Try to apply systems approaches, holistic approaches, and understand that the health of animals, the health of humans, the health of the environment, it's interlinked. They are not completely independent. So we cannot really continue to think in silos, and we need to take systems approaches to the health challenges that we'll face in the future.
Yes, thank you very much. I have indeed an interesting question on the chat. I think you could read it as well. Chris Gallagher has put the question: what challenges to One Health are presented by the private sector where commercial interests may take precedence? Is that a problem? Has that been a problem in the corona pandemic crisis? I did not feel that personally, apart from the interest of pharmaceutical industry to make money with vaccines, which is perfectly right. But do we have under One Health ideas, do we have a challenge by commercial interests? Luis, Paulo?
Sorry, I'm having some interference. Well, now it's better. So I'm probably not in the best place to answer this question in particular for the pandemic responses. I do believe that we need to apply transdisciplinary approaches, and that means that we need to involve all the stakeholders, including the industry. Now, when we think about One Health, it has a strong sustainability component, and sustainability and economic interests often clash. So that might be indeed one of the challenges, but I think we really need to try to overtake that by using transdisciplinary approaches and get all the stakeholders at the table.
Paulo, and then Bruno Gonzalez Soren has a question as well. Paulo, do you want to reply, or?
I just wanted to add that the industry is very important, and in fact, the industry here in Spain, at least, for the production of the vaccines, for the synthesis of the vaccines, all the veterinary industry switched to make and to do vaccines for human use. So that's a very classic and straightforward example that there is currently a very important collaboration between industries from different sectors in this One Health perspective.
Yes, I think that is very important, though it also has a second aspect as well. I mean, if I remember that the German government subsidized BioNTech with 375 million euros to develop the mRNA vaccine, and then sold the licenses to Pfizer to make money on it. I'm not a communist by birth, but you can become a communist by education sometimes if you hear stories like that. Paulo, I'm sorry, I don't want to.
No problem, and I just want to say that I agree with Luis and with Bruno. I think that this is something that we should be aware. Industry is a partner that is essential for the progress and for the development of health and health knowledge, and we should try to deal the best way with it. But of course, there are always challenges that we must face and that will be within us when dealing in this concept of One Health. Let me just also say that this is a great opportunity to develop this concept of One Health, dealing with this pandemic. It's the best time to improve and to try to boost this idea of One Health throughout all the society, and I think that we should not lose this opportunity.
That was a very good final word on this discussion. Renz, was that an attempt to ask for the floor? Or because I saw your hand go up, but after you're muted, I can't hear you.
I am unmuted. Can you hear me?
Hello, Frans van Dobbenberg.
Can you hear me?
Yes, now we can hear you.
I was unmuted, but okay. I think in these cases we never can do without the private sector, the commercial industry. But I think this also can be a plea out of the One Health approach to be sure that during, let's say, peacetime, we build good relationships and good appointments with the industry, because I think a lot of trouble, or what some people have seen as trouble, has been caused during COVID by the situation that we were not prepared, and preparation you should do during peacetime. And I think this is the thing we have. This is the lessons learned from the past year. I'm sure we never can do without the private sector, without commercial interest, but we have to include them in an early stage so we can have normal appointments. Thank you.
Yes, thank you. Allow me now to sort of close this discussion on the lessons learned during management of a pandemic and move over to the lessons learned from the collaboration against antimicrobial resistance, which is the second topic on our agenda today. I'm very happy that we have Dominique Monet with us. He has been a long time director of several programs of ECDC in Stockholm. He has a very interesting career as a Frenchman, to have been working in Denmark before that at Statens Serum, and now in Sweden. I think that's very important, and you will tell us probably something, maybe something in the discussion later on the enlargement of the portfolio of ECDC, which we reckon is a very important instrument, a very important tool, not only in beating or battling against pandemics, but also in our pledge to collaborate against antimicrobial resistance. So please, you have the floor now. Question is lessons learned from collaboration against antimicrobial resistance. Dominique, you have the floor.
I hope you see the slide now and you hear me. Good afternoon, and thank you for this invitation. As you know, ECDC is an EU agency with a mandate of risk assessment and risk communication on communicable disease for human, a focus on human medicine, but the risk management of those diseases under the principle of subsidiarity remains the responsibility of each individual member state. Of course, there is a plan to enlarge the CDC, but I do not have views about this. You may ask your question, Frank Ulrich, to the European Commission. Of course, if I would say that at ECDC, we're not against having more resources for doing what we do, but I think the additional resources will come also with additional responsibilities. But it's not, I would say we do not have a view about this for the time being, and we eagerly waiting what will happen. So usually when I make a presentation to your organization, I start with a lot of data, and I will not do this today because that's not the topic, and you've seen those data. It's just a reminder that if you're looking for data on antimicrobial resistance, you will find those on our website, and I'm put a pointer at our directory of online resources for the prevention and control of antimicrobial resistance and healthcare-associated infections, because this is where you will find all the guidelines for different topics, not only from WHO at EU level, but from each individual member state, and other member states can take example on those. So if your organizations are not listed there, then please to us and we're happy to put a link. This said, what have we learned about interdisciplinary collaboration and One Health collaboration on antimicrobial resistance in the past years? Well, there are two sets of guidelines, one focusing of EU guidelines, one focusing on the prudent use of antimicrobials in veterinary medicine, that lists the responsibilities of different groups of professionals that work in or in connection with veterinary medicine. And then we have a second set of EU guidelines for the prudent use of antimicrobial in human health from 2017 that also lists the responsibilities of different groups of actors in human medicine. Collaboration is rarely mentioned, and is certainly not mentioned within the two groups in a One Health perspective. I would say that at EU level, the One Health collaboration on antimicrobial resistance is under the responsibility of the European Commission. And the two action plans, and I wanted to flag the first action plan is from 2000. So at EU level, that's around the time when we started talking about One Health collaboration on antimicrobial resistance. And this has been renewed in a second European One Health action plan in 2017. And the member states and the EU, the Minister of Health in the EU member states have also approved council conclusions that put another layer of responsibility on themselves and on the member states and on ECDC in two sets of council conclusions, one in 2016 and one in 2019, just before the pandemic. At ECDC, we collaborate with other EU agencies. So it's something we've done for a long time, sometimes upon request from the Commission, sometimes upon request from one agency to the other, sometimes on our own initiative. So ECDC and the European Food Safety Authority, EFSA, collaborate and produce each year a report on surveillance of antimicrobial resistance in Salmonella and Campylobacter infections. And ECDC also contributes to various scientific opinions of EFSA's BioAS panel. ECDC and EMA and also collaborate as a bilateral collaboration. In particular, ECDC contributes to the EMA's AMEG, or Antimicrobial Advice Ad Hoc Expert Group, that produces advice upon request from the European Commission. And then there's a tripartite interagency collaboration between ECDC, EFSA, and EMA to produce a joint interagency antimicrobial consumption and resistance analysis report. This is upon request from the European Commission. There was a first report in 2015, a second report in 2017, and the third report is currently with the copy editors and will be published at the end of this month. I must say that we've learned to overcome our various cultures, ways to work, ways in the Harvey agency approved documents. But this is because we overcame these hurdles that we're able to produce reports like this. So I invite you to check our website at the end of June for this third report. Since we're discussing collaboration, you wanted examples, that I reflected and I said, what are the areas, and do we have practical example of where, if collaboration does not happen at the practitioner level, then it should happen. And I thought about collaboration between general practitioners, hospital doctors, and veterinarians when it comes to livestock-associated MRSA. This affects patients, this affects farm workers that move to work from one farm to another. This affects the farmers and their families. And in some countries, ultimately, there have been cases in hospitals. I wanted to flag also healthcare-associated and community onset MRSA and multi-drug resistant enterobacterials such as E. coli. This affects patients, family members, and they have been circulation of certain strains between the pets, the pet owners, or between someone who's been hospitalized in a family, and then other member of the family would be colonized, but also the pet would be colonized for a long time, and then the family would be colonized again. There obviously are areas of collaboration between GPs, specialists in the community, dentists and community pharmacists, veterinarians and community pharmacists in those countries where veterinary prescriptions are actually dispensed at pharmacies, and there are some EU member states in this situation. And then between community pharmacists and hospital pharmacists for prolongation of certain long-term prescription. And in healthcare settings, there's collaboration between all sorts of professionals. So these are all examples, practical examples of if at one point your organization wanted to work in one specific areas, could make a case by working in this area. Now we're talking about the COVID pandemic, and the question that everybody had last year is, does COVID have as an impact on antimicrobial resistance? And while everybody would say yes, the answer is actually less straightforward and most likely contextual. We know, for example, that there have been reduction in antibiotic use in the community, and there are already data from Ireland, from Portugal, from the region of Stockholm, from the region of Emilia-Romagna in Italy, where there have been less prescription of antibiotics. And in Stockholm, it's less consultations, in particular of children. But at the same time, the UK has shown that there have been more prescription among dentists, from dentists during the COVID pandemic in 2020. In hospitals, there are different studies that have been published that show sometimes an increase for a few months during the peak of admissions, in particular in intensive care. And there may have been also super infections, but the proportion of patients that are admitted with bacterial co-infection in addition to COVID, or that would have super infection, is relatively low. And the increase in prescription is short-lived. What will be the impact on resistance, we don't know at the time being. And then there are several points that we have been putting forward, factors that would have influence infection prevention control in hospitals, that would have influenced hygiene practices in the community, and have influenced cross-border spread, and including One Health. There are two issues here, or three points that I would like to make. The first one is whatever is listed in this table and this publication or surveillance last November is backed up by references. So this is as much evidence-based as it can be. But our frustration was that as of November 2020, we didn't have the European data that we would like to have. And we will have this data sometime now over the summer to be published in the autumn. And we'll know what's happening with antibiotic use in member states and possibly an impact on antimicrobial resistance. So let's move to the next slide. Now, if we want to work on education, I wanted to pull out this recent article, which title is Information Avoidance Behavior. Does ignorance keep us uninformed about antimicrobial resistance? So it's a study done in the United States among a bit more than 1,000 individuals. These are not professionals. These are picked in the general population. And they're assessed for their knowledge and perception of antimicrobial resistance and antibiotic use. The study is the role of subjective and objective knowledge of antimicrobial resistance and antibiotic use in livestock production. And how would this information avoidance. The participants also had to make a choice to access or avoid an animated video that would provide information on antimicrobial resistance. So out of the 1,000 plus participants, 39% avoided information about antimicrobial resistance. So they had questions about their knowledge on antimicrobial resistance, and then they had the choice of clicking on an animated video, and about 4% didn't click on that video. The participants with little knowledge of antimicrobial resistance were more likely to avoid antimicrobial resistance information. And after watching the video, perceived importance of antimicrobial resistance increased the most for those with low initial subjective knowledge. So this is not a study from ECDC. This is something that I invite you to read that could easily be transposed to professionals, that highlights the need for basic, common knowledge about what is antimicrobial resistance. How to communicate about antimicrobial resistance. If you ask the general population, and this has been done in the UK, AMR means nothing. People say, what do you mean? Give me a definition. So it works for us, doesn't work for a lot of people. I don't know if it works for most professionals. I would say no. And then there is the issue that the one that know think that they are resistant to antibiotics or antimicrobials and not their bacteria. So the Wellcome Trust produced this report and toolkit that I wanted to list here because it highlights the mistakes that we've done in the past, and it puts forward what it should do. Frame drug-resistant infection as undermining modern medicine. Explain the fundamentals succinctly. Emphasize that this is a universal issue, it affects everyone. Focus on the here and now and encourage immediate action. At ECDC, we've been working on a European Antibiotic Awareness Day, an idea that WHO took on board back in 2015, and this became a World Antimicrobial Awareness Week. There are key messages, including for professionals. I don't think we have key messages for dentists, and that's a call for the dentists here. We do not have a mandate for animal health, and we cannot host, for the time being, key messages for veterinarians and other professional animal health. Anything that we have so far for prescribers in human medicine and for other healthcare professionals is not only in English, it's available in all EU official languages. You just have to click at the top right and choose your language. And it comes with all sorts of materials, and it all is backed up by evidence. I reminded you about the dates here. So last year we tried to work on this interdisciplinary message, with a video that would address all the healthcare workers in hospitals and long-term care facilities in the EU. I will try to show this video and I hope it will work.
Antibiotic resistance is increasing globally. As a healthcare professional, what can you do to keep antibiotics working? Antibiotics have saved millions of lives around the world, but antibiotic resistance keeps increasing globally, including in Europe. We are now facing the possibility of a future where antibiotics will no longer be effective. Up to half of all antimicrobial use in European hospitals may be unnecessary or inappropriate. For example, the patient may not require antibiotics in the first place. Or the antibiotic prescribed may be of the wrong dose or of the wrong kind. Or the antibiotic may be given to the patient too late or for too long. Everyone working in a hospital or a long-term care facility can do their part to preserve the effectiveness of antibiotics so that they can still cure infections. As an infectious disease specialist or clinical microbiologist, you can set up an antimicrobial stewardship program. This can ensure that tools and guidelines on how to use antibiotics are disseminated and followed, that staff get...
Dr. Monet, we can't see the video, we can only hear the audio.
And control measures are implemented.
So you have to tell me
As a
before.
clinician, there are also many things to be done.
All right.
You can ensure that infection prevention and control measures are implemented. You can ensure that antibiotics...
We probably don't have enough time, do we?
I was wondering, yes, because we are running a little bit short of time.
Yeah. So let's go back to the slideshow and conclude. So Mac, I hope you will be able to see the video and you have a link with the presentation. It is available with subtitles in all EU languages. So in conclusion, I think we moved away from pointing at each other in terms of responsibility, at least at our level. We know that everyone is responsible and just have to walk the talk and do our share of the common work. I would suggest, and this is because of this study that I showed to you on avoiding information, a basic common, training for a basic common understanding of what is antimicrobial resistance, what can be done about it. Because if we don't do this, it is unlikely that people will look for more information. And then build blocks rather than try to have, you know, a huge, ambitious strategy and implement actions gradually. And then maybe so areas, specific areas where you may want to work, and then use existing surveillance data and evidence-based key messages. It's difficult for people to argue against scientific evidence. Thank you very much.
Thank you very much, Dominique, for this interesting and comprehensive presentation, which I think gave us a lot of insight. Just by pure chance, I would like to put a question to you because I found very interesting your slide on the consequences of the COVID-19 considering antimicrobial resistance. Could it be that there were less infections, overall infections in general, as people kept to masks and hygiene regimes, processes, and we had less
and stayed home and the kids didn't go to school and people teleworked? It's possible.
Yeah.
We don't have, I mean, one hint in this direction is the absence of an influenza season.
Exactly. And I've seen much less people with neuro disease or with other infectious diseases, which are not connected to antimicrobial resistance. But I think that we will rediscuss the use of masks in Europe pretty soon, because I think it's very helpful in many other diseases as well.
Yeah, and other parts of the world have a tradition of using masks in crowded areas. Yeah, that's correct. I don't have more evidence about this, except what I said about the influenza season, which has been inexistent.
Yeah.
And the fact that in Stockholm, there has been much less consultation of children.
Yes, thank you very much. Very interesting. In the interest of time, I will now move on to Merel Langelaar, who is a veterinary from, I think, almost most of your life you spent in or around Utrecht at the Faculty of Veterinary Medicine there. You've done a lot of interesting, held a lot of interesting positions in public health, public veterinary health, and you're also talking to us on the lessons learned from collaboration against antimicrobial resistance. So Merel, the floor is yours.
Thank you very much. I'm going to look for my presentation first.
Yes, that would be good.
Yeah. And then, funnily enough, I cannot do not see it. Oh, wait, just a second. I'm working on two screens.
If you would prefer, I can also share it.
Just a second. I might be able to find it. Always the same thing. Yeah, could you share it? Because
Yes, will do.
I see my agenda in my email box, but not what I need. That's funny. Thank you very much for the invitation. And there it is. No, there it's not.
You should see it now.
Yes.
Yeah.
If you can put it on presentation mode, can I take over control maybe?
Maybe, but I can also just.
Yes, well, yeah, I might be able to. No, it's only you.
You can let me know and I'll click.
Yeah, okay. Well, I just wanted to say thank you very much for the invitation, and I'd like very much to be the speaker after Dominique. You said I spent much of my time in and around Utrecht, which is true, but I did also spend a lot of my time in human healthcare, as I worked for over 7 years in the healthcare inspectorate, and there is where on several occasions I also met Dominique or his work. So I had a bit of a One Health career myself. Can you show the first slide, please? My first slide doesn't have so much to do with the rest of my talk, but for all those people looking and not knowing this research, it's one of the most beautiful research I've been seeing in the last years because of its simplicity. And please, I would like to invite you all to go to Google the Kishoni Lab and look at this little YouTube film where you can see antibiotic resistance developing in front of your eyes within 2 minutes, which is really very nice and beautiful and simple. Next slide, please. Fortunately, many of the things I'm going to say have been said already by the other speakers, so I think we very much agree on the One Health approach in general and also specific things about it. As has been said, we are all interconnected. The whole world, humans, animals, and the environment is interconnected. And so are the microbes going around in our in humans and in animals. And what with this little picture that I made years ago, what has also been said is it's not, I think One Health is not only about humans and animals and human medicine and veterinary medicine. The thing is that our own healthcare is also much organized in silos. So especially in human healthcare, as I recognized working at the inspectorate, there is the nursing homes, the hospitals, the public health. And I also think that One Health approach in human healthcare starts with a common health approach for humans also working together in the different silos. Next slide, please. And I think that dentistry is included in human healthcare, to be precise. Well, AMR, what is the problem? We all know it's a huge problem. There was this nice review by Jim O'Neill, who was a banker, that made a nice pictures of what is going to happen if we do not do anything, what will happen to us, and what is the AMR problem going to be. And well, he envisages that by the year 2050, it's going to be an enormous problem, a much bigger problem than all kind of other infectious diseases or road and traffic accidents altogether. The thing is, if you look at this review from the more scientific content, epidemiological, biomedical perspective, then you might say, well, those figures that he presented, I don't know if they're really true, if it is this black and white, and well, you can say the estimates, there are many extrapolations in this study, so it might not be true. Well, I think that is very nice for an academic debate amongst microbiologists and doctors and veterinarians. The thing is, with this survey, with this review, he put AMR very high on the agenda, on the world agenda, and for the government. So I think that is the most important spin-off of this review, not so much the figures and the numbers that he shows, but more the attention he draws to AMR as being a real problem for all of us in the world. And what is then the problem in the future if we do not do anything? Well, then to make it tangible for people, it's going to be about, and Dominic also told us already, it's about newborns in hospitals that we cannot treat for infections, even the most simple ones. It's about surgery, complicated surgery, that we cannot use the right antibiotics. It's about people being treated for cancers and that might die of just a stupid small infection if it is with a resistant bacteria. And in the public, because this is all hospital care, intensive care, and in the general public, the first problems will be the bladder infections with resistant bacteria. Because for now, so far, at least in the Netherlands, but I think in all of Europe, in the general public, for public health, antibiotic resistance in itself is not the most problematic. We're not the most problematic is in the hospitals, there where the really fragile people and patients are. Next slide, please. Well, antibiotic resistance, as you also, and I very much like the slide Dominique made about the different people collaborating within healthcare, or the GPs and the veterinarians, I think, and also the other things you mentioned. AMR in itself is a very abstract thing, like climate change or whatsoever. So it's abstract, and that means that even for veterinarians or doctors or dentists, it's well, they don't see at a daily basis the effects it has and the problems it causes. But from time to time, we do see it. For example, when you are a veterinarian or a livestock keeper and you go to a hospital in the Netherlands, you might very well be contaminated with the livestock associated MRSA, and in human healthcare, a lot of measures are being taken to prevent this MRSA from spreading in the hospital. So that is on a very specific, personal, day-to-day practice base that you do have a problem. Next slide, please. Well, then in the Netherlands, it was around, I think, between 2007 and 2010 that we really started talking about antibiotic resistance, and the ministries were alarmed about the huge amount of antibiotics being used in livestock production. And then, of course, what happens pretty quickly is that people start blaming each other. The doctor said, oh, you see, you veterinarians, you provoke all our problems in the hospitals. It's your fault. But then the companion animal doctors would say, well, no, it's not us. It's those that treat large animals. And then in cattle, in the cattle industry, they would say, well, no, it's intensive farming. That's the problem. And in pigs, they will say it's the fault of the poultry keepers. And then the poultry keepers will say it's the fault of the public because they pay the same amount for an egg as they did in the Second World War, and they should pay us more than we can invest in our poultry systems. And then you have this circle all around, people blaming each other. I think it's not of much use to scapegoat each other because that will not bring us solutions. This is our famous One Health approach. I think, like could you put the next slide, please? Like in COVID, we have been saying it pretty often, we are in this together, and we should help each other to get out of it together. Oh, is it? I think, are you blocked? Yeah. Okay, so what is a solution? A One Health approach. And I think in the Netherlands, we were privileged in that sense that just a few years before, we already had an infectious disease crisis, which was the Q fever outbreak. And that already learned us that veterinarians and doctors and the medical field and the veterinary field should work together to get out of this crisis. So we in the Netherlands, and especially our ministry, were a bit primed toward this One Health approach. And we used it also to tackle AMR. Next slide, please. Well, here you see what the tripartite says about One Health. It has been said before in its simple definition. It's about managing problems at the interface between ecosystem, animal, and human health. Next slide, please. Well, if there is a problem with AMR, is there a problem with resistance? Usually there is an intrinsic link between the use of antibiotics and the development of resistance. But if you want to tackle AMR, it's also simple in itself. You should know what goes around, so you better have your surveillance in order. You should use antibiotics if you have to use them prudently, so you need a sort of a stewardship system. And you have to fight against infectious disease circulation. So infection prevention and control, it's called and biosecurity in livestock keeping, but infection prevention and control in human healthcare centers are the three pillars of fighting against AMR. Next slide. And then I think it comes to the One Health approach. These three more or less technical things, if you want to, well, let's say do them, you need a One Health approach because it will lead you to a synergy. It will not, everybody in a silo doing his own things will not make this synergy, but collaborating will lead to a synergetic effect. The thing is, and that has been said also, I think what is important is to know which cogwheel in the bigger part you are. What is your place in the bigger picture, and what can you do yourself to help the greater good? And I think you also have to consider if are the benefits for the individual, for the group, for the population, for the country, or for the world, and is it on the short term or on the long term? And you have to know altogether in which direction are we going. And then there's a lot to do about sharing knowledge, and sharing knowledge is partly education, but I think it's also sharing the knowledge of who do you need to collaborate with, because we need to collaborate, but you need to collaborate with the right person, otherwise it will not lead to something. And there were remarks about in peacetime. I think indeed in peacetime we need to use the time to find our collaborators, and we also need to practice. So we need to do exercises to practice what can happen to us, because otherwise collaboration by doing nothing will not be a real collaboration, and it will not lead to something. And I think as a whole you need people taking responsibilities at all the different levels, so individual levels, in your scientific community, at the government level, at all the different levels. You need people taking responsibilities and also people taking leadership. And I think there also we were happy in the Netherlands with the Minister of Health at the time, Minister Schippers, that really took responsibility for the AMR problem, and she took it also. She would know it was being left out. If you compare it with the COVID period, it didn't become a political thing. I think one of the problems in the COVID period now is that it becomes very much political and thereby polarized. Antibiotic resistance, the Minister of Health took it as her responsibility to do something, to invest in it. And she would know that it would not, when she was gone after 4 years of governing, it would still be necessary to go on with this AMR. So she could not really, she would not be applauded for being the one fighting resistance and finding solutions for the problem, but she started things, and I liked it very much. And of course, we need to know things, so we need research. Next slide, please. So that's what I already said. You need collaboration at different levels, at the local level, between ministries, between research groups, between the different scientific parties, between professional parties, between the different healthcare settings, the municipal health service, human and animal supervision and enforcement. All different levels need their specific collaborations to achieve the goal you wish to achieve. Next slide, please. Well, in the Netherlands, as I said, the ministries took responsibility, and a lot of things were being set in place. And in the end, by 2010, we were really the bad guys in livestock keeping, using enormous amounts of antibiotics. But then in the end, we became the Dutch example how to fight antibiotic resistance and work together in a One Health way. Because as we said, if we want to control a problem in healthcare, so for the people, everybody should act where antibiotics are being used. So whether it is in human healthcare, in veterinary healthcare, in dentistry, whatsoever, we should all work together. And we developed a pretty nice national action plan. And by now in the Netherlands, at least in the healthcare settings, people are working in 10 different AMR networks. And that is, those networks is where the hospitals as a kind of a hub, the large academic hospitals work together with long-term care facilities, municipal health services, microbiologists, and the peripheral hospitals in a network. And there again, a network is a structure where people collaborate and work together, and they exchange knowledge. But also in this type of networks, what is being asked is a kind of medical leadership. You always need somebody who wants to draw and to push forward the things. So that is a thing that is really needed, and that is sometimes difficult to find. I think to me it's one of the problems. Next slide, please.
Just like to remind you, we are running a bit short of time.
Oh, I'm finishing.
Yeah.
Well, this is just about education, because we need a lot of education. We already talked about that. On the specific undergraduate and graduate education and lifelong learning, we need guidelines and quality systems, and we need to know the impact of our professional conduct. But what has been said before, I think what we very much need in a One Health approach is the medical veterinary social sciences, because all this is about collaboration, about human behavior, about knowing what people are going to do, about knowing the barriers to antibiotic stewardship, etc. So what we need is the social sciences, and we need them badly. Next slide, please. This is my last slide. So the lessons learned, I think, from AMR and collaborations are not so much different from what we learned from COVID. What we need is leadership at all levels, formal, but certainly also informal. And I think this type of debate is a nice example of informal leadership being taken for problems and a One Health approach. We need biomedical education in a One Health context, working together in education, but also we need social scientists. We need to keep it on the agenda. If there's one thing about AMR, which is difficult, and especially I think in the COVID period in which we are now, keep it on the agenda. I've heard from many other European countries when we did peer reviews, people find it difficult to keep it in the agenda because there are always other things, and especially acute things like epidemic and disease outbreaks. It always seems more important than this gradual chronic thing, which is AMR. And then also keep it simple. And that's why I started with this nice research in the beginning. And I want to finish with it also. Know your own place, know what you can do, keep it simple, and all together go to the same goal. Thank you very much.
Thank you very much, Meryl, for this interesting presentation. I think the most important issue at the beginning was that we stopped the shaming and blaming attitude which we had in the past. I think this is what made it so easy and easier, or at least easier for us to get along with each other and to resolve the problems. Now I have two more speakers. And then it is said on the program outline, the panel discussion. I think in the interest of time, we won't have the opportunity to have a panel discussion, but I would like to give our two next speakers the chance to address us. It is on one hand Lucie Carouet, who is working in the European Commission. She is a political scientist. And she is very important for us because she has been the deputy to Xavier Prats-Monet, to Anne Bucher, and now to Sandra Galina. And so she has a very important position in the DG Santé at the European Commission. So please, Lucie, give us your view on the issue of promoting One Health in professional practice. And then we will have Bruno Gonzalez-Son from the Federation of European Medical Academies, who will give us his view as well. Then I would like to ask Rens van Dobbenborg to conclude. I'm saying this because I'm terribly pressed in time. I only have 5 minutes over our allotted time because then I have the next meeting. That is the curse of virtual meetings these days, that you have one meeting following the other in short distances. So please, Lucie, give us your speech.
Thank you very much for inviting me to this debate. I will try to share my screen as well. Let's see if it works. Can you see the slides?
Yes.
Yes.
So thank you. I was indeed previously assistant to the DG of 3 different DGs in DG Santé, and now I moved to the unit dealing with AMR and animal welfare as deputy head of unit. So in fact, the presentation I have prepared is a bit of a prolongation of the session we just heard, and a number of things have already been said, which will allow me to move a bit faster in the presentation, which is good given the timing we have. So our ECDC colleague already mentioned that the basis for our work in the European Commission is this 2017 One Health action plan against AMR. I just wanted to mention that it has been really a cross-sectoral exercise to establish this action plan. So 9 directorate generals have been involved. So this really reflects already the One Health dimension of the issue. The objective is to preserve effective treatment of infections in humans and animals. And the action plan contains in total 75 concrete actions. So these actions are structured around 3 pillars. First, making the EU a best practice region on AMR. Second, boosting research, development and innovation on AMR. And third, shaping the global agenda. I wanted to focus a bit on some deliverables that we already have from the implementation of this action plan. Here you have a slide showing real One Health actions, in particular the One Health AMR visits in member states that were conducted by the ECDC jointly with Directorate F of DG Santé, which is the directorate responsible for audits and analysis. In several member states, in a series of member states. So these visits were done as fact-finding missions, so to support and accompany the member states and advise them also a bit on the implementation of their One Health AMR action plan. They have been suspended because of the pandemic, of course, but my understanding is that they will be relaunched soon. I will come back to it at the end. The JACRA report was already mentioned earlier. So this is, of course, a very unique type of report because I'm not aware of other regions in the world which are doing this type of joint reports between 3 agencies dealing on AMR. We have also launched a joint action on AMR and healthcare associated infections as part of the health program. So this joint action actually is now being finalized and will be presented to the health and agri-fish ministers in the course of this month to show a little bit the concrete results of this work done. I think 15 or 17 member states were involved. And also to use these opportunities to raise again awareness at political level on this issue. We have, of course, our One Health AMR network between the Commission and the member states with biannual meetings, which is bringing together basically colleagues from the health ministries, colleagues from the agri ministries, and colleagues from the environment ministries in a One Health approach. So that's a bit the novelty of this network compared to existing network with member states. Other deliverables that I wanted to mention, the guidelines on prudent use of antimicrobials in human medicines were mentioned. I will come back to them. We have, of course, on the veterinary side, a very important deliverable in the form of a new regulation on veterinary medicinal products and medical feed that was adopted in December 2018 and will enter into force in some months. And on the environmental side, an important strategy paper, which is called the EU Strategic Approach to Pharmaceuticals in the Environment, which was adopted in March 2019 and is in the course of being implemented. And at the bottom of this slide, I included a link where you can see more details about where we are in implementing all of these 75 actions. You have a nice table that shows the overview. So now coming to professional education and training, which is the topic of today, I thought it would be useful to give you some extracts of these guidelines on prudent use that were already mentioned by our ECDC colleague. In the veterinary field, already in 2015, the guidelines were saying that vet faculties and agricultural schools should ensure sufficient attention to AMR in undergraduate and postgraduate programs. That information on AMR should also be considered in secondary schools, and that veterinary professional associations should develop guidelines on prudent use, promote their implementation, and provide specific training to veterinary practitioners. Also, on the human health side, we have a bit of the mirror with an explicit recognition of the need for interprofessional approach. These guidelines mention that healthcare professionals the competency of healthcare professionals on AMR should be guaranteed, that training on prudent use should be included in medical, nursing, pharmacy, dentistry, and midwifery schools with a strong practical component as part of an interprofessional approach. They also mentioned that education on prudent antimicrobial use and AMR, vaccination and hygiene should be included in primary and secondary education. So going a step further compared to the 2015 document. I also wanted to mention a project that is co-financed by the EU, which has been launched recently. It's called the Happy Patient Project, whose main aim is to actually support the take-up and implementation of the EU guidelines on prudent use in human medicines through this project. So it runs from January of this year for 3 years. Okay, you have the details about the financing and the beneficiaries. Also, I wanted to thank again your associations for having presented the joint initiative to implement the One Health in undergraduate education at the occasion of one of our One Health Network meeting in March 2019. This was very, very appreciated by the network members, and definitely we can reflect if a new type of presentation would be needed in an upcoming meeting. So to conclude, this was said already by previous speakers, but as we all see, all these activities, whether the joint action, the One Health Network, all the work that is done around the One Health national action plans, show that we need to enhance cross-sectorial collaboration. And really the fact of developing a culture of cooperation across professions at the level of education and training, it will be the basis, the fundament to build this One Health culture also at other levels. So just to conclude on what from the Commission we have in mind as next steps on AMR, we have now launched a specific desk exercise to review the One Health National Action Plan of the Member States. And we will also be reviewing our 2017 EU Action Plan to really reflect on what's next, how to take this further. At global level, we are actively working to promote a revision of the global AMR action plan and to put AMR high on the agenda, whether in the G7 or in the UN Food System Summit and in various global fora. We had actually this morning an interesting discussion on interagency cooperation on AMR, so linking even more closely the ECDC with EFSA, EMA, but also the EEA, ECHA, and others to work on AMR projects. We are also reflecting on options to revamp our AMR One Health Network with the member states to make it maybe more dynamic and active. And finally, to close, I would like to stress that the COVID-19 pandemic has led the Commission to take a number of initiatives in the health area, which are very important ones, and that will also allow the EU to take further actions on AMR. In particular, I'm thinking about the pharmaceutical strategy, the intention to set up this Health Emergency and Response Authority, the EU for Health program, which is much bigger than the previous health program, and what we call in our jargon the European Health Union package, which was a package of legislative proposal put forward in November last year to revise the mandate of the CDC, of EMA, and revise the cross-border health threat legislation. So that's about it from my side. I had a few slides on the figures, but I think we already discussed this, so I will stop there. Thank you.
Thank you very much, Lucy, for this comprehensive overview over the strategy and the policies of the European Union. Thank you, and we'll move on to Bruno González Zorn. I know he speaks German, therefore I can say I'm awfully sorry, aber den letzten beißen die Hunde. That is the problem when we are running so short of time. So I won't waste much time introducing you, simply saying you have a very interesting career in microbiology and veterinary medicine, and you are responsible also for a lot of academic questions here. You are the representative of academia in a way here for us today. So please, I would just like to have your opinion on treating AMR together from the big professions in healthcare. Bruno.
Thank you. Thank you. Can you see the slides perfectly?
Yes, at least I can see them.
Yes,
Okay.
yes, they're visible.
Okay. So I'm representing the FIAM, European Umbrella Group of National Medical Academies, which is a One Health institution. So it represents 23 national academies from Europe, medicine, medical section of academies of science, pharmacy, and veterinary. So it was born already as a One Health institution. And so it's formed by the elected fellows of obviously of all the academies. It gives independent opinion and evidence-based opinions to different problems that we have in society and in health in Europe. So what it can offer is an excellent and independent scientific advice to whatever stakeholders, especially at the European level. It can help and informs EU decision levels and the ECDC or whatever in policy-making processes. So because it amalgamates all these different professions, obviously it's a multidisciplinary. It fosters multidisciplinary cooperation because it is already a multidisciplinary institution, and obviously cross-sectoral cooperation because there is the members are already forming part of different sectors. And within this umbrella, obviously, it has supported always from the beginning the fight against antimicrobial resistance, especially in education, research, and discovery, and always from a One Health perspective. And this we already said several years ago. But even before that, already in 2004, we were talking about One Health, because there was this network financed with 14 million euros in 2004, coordinated by André Gesta, which was already a One Health European project. So we are talking about the fancy One Health and COVID and so on. In 2004, we were already working in Europe in One Health. And there was a work package that I was leading that was only devoted to antimicrobial resistance. So antimicrobial resistance, One Health, we are already fighting for. So for a lot of years. So sometimes people say, oh yes, it's the future. And I say, well, it's the future. I hope it's the present, because the future, it was like 15 years ago. So I think really that One Health and antimicrobial resistance is the present. And I will not give you all the data, but obviously today we have, for example, a 60 million European project, which was not mentioned. It is what is the One Health European Joint Program, and it is taking all the European, it's doing research in all the European countries. And we're working on One Health for many years, like in this case with Evelina Racconelli and my friend Liz Wellington. So we're working, many people also, and even Jim O'Neill, from a One Health perspective in antimicrobial resistance. And as you know, the message is all the modern medicine depends on the fact that antibiotics work. This is the National Transplantation Society, the Spanish one, because it's worldwide. It's the Transplantation Society that makes more transplant and more effective transplants in the world. So for one thing that the Spanish people do well, I wanted to mention it because it's really, we are very proud of this. So everything is in danger if antibiotics don't work. So my opinion is that antibiotic resistance is the greatest threat in human history. This is what I think. It kills more people than car accidents, but we hear about the car accidents every now and then in the news, but about the anonymous patients that die every day in our hospitals, we don't hear anything. And as you know, thanks to the CDC, we know that how many antibiotic resistant bacteria we have, and the problem is that antibiotic resistance is out of control, as you can see very well. In none of the European countries, this is E. coli fluoroquinolone resistance, for example, has an antibiotic resistance gone back, except of, I know, UK MRSA, which they controlled very well because they had an hospital epidemic. But in general, it is not controlled yet. There is a lot of One Health collaboration, and this is one of the cases, for example. Colistin started to be used for some years in human medicine, but it was used in animals for 50 years because it was too toxic for humans. But we suddenly needed it in our hospitals, and what we did, for example, in Spain, we reduced in 3 years 97% of colistin use in animals. This is a clear example of collaboration, One Health, antimicrobial resistance. And antimicrobial resistance became in 2011 already in the Commission, in 2014 a very important high in the agenda. Being the European Union worldwide leading, which is also not the case for all the different issues in the world, but in this case, Europe is really leading this issue. And in 2016, it was not a personal opinion. Already the United Nations said antibiotic resistance is the most important problem in the world. It was confirmed already in 2017 by the G20, where we already talked about that we have to make a collaboration hub on the One Health perspective. So already the G20 was talking in 2017 on One Health. As it was repeated in all the meetings until this month, where in this Global Health Summit, in the Rome Declaration, it was said that One Health and antimicrobial resistance should be kept highest in the agendas. It's true that some people did want to take it away, but we managed to keep it there for now because it's really important. And in fact, next June, for example, we are going to present a joint program initiative, in the joint program initiative, a European or more world a research institute on antimicrobial resistance. We are here to talk about education and training. This is what we say normally, we think when we say training people. What we did, and I think that's something that we have to do, the Spina did something similar, is, okay, we want to train the people more in AMR, but what do they know about AMR? So we've done in all the vet schools in all Europe, that means 103 faculties, a surveillance to know how much do the people know about antimicrobial resistance in the last course. And that's very important, because once we know what's the state of the art, we can then have further actions. And all these countries participated, 103 vet schools, you can read it. But that's very important. I want to do the same in all biomedical degrees in the European Union. So to do the same surveillance in medical, pharmacy, dentistry, etc. So I think that this, we have to do it with your help or not. I hope with the help of the European Union. Our surveillance we did with the European Society of Clinical Microbiology and Infectious Diseases, so a scientific society that financed it, but I think that we should do that maybe from the ECDC, from the European Commission. So it would be enough in AMR if we do like a 1-week course in the last year of the university to tackle antimicrobial resistance. Because in the last year of the university, you know about pharmacy, pharmacology, pharmacodynamics, etc., etc. So there, a single course of 1 week in all biomedical faculties in Europe, talking about AMR, how to choose the right antibiotic, for me would be ideal. If we want to train them in One Health, I think that one week is not enough because there's no background on One Health. So I think that probably we would need one whole semester in all the universities in Europe. And in fact, in one alliance of 8 universities that we have in Europe, it's called Una-Europa, we are there in a Complutense University, together with Berlin and Edinburgh and so on. We are already fostering a One Health PhD program and One Health classes, but it's only a university alliance. I think we should do this in all Europe. Who is coordinating all this education, proper education in AMR in Spain? Our National Action Plan. So our National Action Plan is One Health. All the national action plans on AMR of your countries are One Health. They work with antimicrobial resistance and antimicrobial use in humans and in animals. It is from there that we should foster the education in all our single countries. And that's what we are doing in the Spanish Action Plan. You can see here on the left, you don't know Spanish, but you should. So it's in all the educational areas, we tackle antimicrobial resistance from our National Action Plan in our universities. We could do that also from the ECDC. Dominique hasn't said it, but there's a very good visual academy, and maybe from there we could foster these courses, One Health, antimicrobial resistance. Dominique, I hope that you agree. When we talk about education, we talk always about this sector. So let's educate these people and so on. We have done something a bit broader. I think that here we should educate. And so for this, what I do is I take medical students, veterinary students, and pharmacy students. I collect them, I teach them antimicrobial resistance, and they go to secondary schools in Spain and teach their antimicrobial resistance and make a program that we imported from the US, from the University of Yale, which is called the Tiny Earth. And there we teach the students, and my students teach the secondary students what is antimicrobial resistance, and they do hands-on laboratory practice. So they take bacteria from Earth and they see how they act against escape bacteria. And that's very important because I think that my effect probably in my life on antimicrobial resistance is much less probably all the papers that I'm so proud of and they are so fancy. Probably this has a higher effect in all the secondary students because these students now are medical students because it was in the last years, 3 years ago, they are medical students, veterinary students. So we started with that and now it's 50,000 students that we teach every year in all Spain with this network. I think we should implement something like this in the European Union. This is called, and I'm going to bore you with this, service learning. So the students, my students and the secondary students teach by also giving a service to society. And something that we have not talked a lot is the environment. So I agree that we are here very nice because we communicate very easily. Medical doctors and vet doctors and dentists, we communicate easily. We know septic chemia, antibiotics, we know them, but to communicate with the people from the environment is not so easy and it takes a lot of energy. So we are talking about One Health, but I think that we are skipping this environment, and I know what I'm talking about. We published this year. There are E. coli, Klebsiella, multi-resistant to antibiotics in rivers, and not only in wastewater, and we have to pay attention to that. What happened with the COVID? in the universities, we have built a diagnostic laboratory. So we've done a network of laboratories coming from the Veterinary Institute and taking medical and dentistry and universities on board. And we've done in the first wave 25,000 PCRs in elderly homes to separate the people that were infected or not. This action was not done by the government, but we did it from the veterinary university. What will happen with antibiotic resistance? And here, Dominique, here you have the answer. So this is the answer. Here you have a study that I published this month, but here we see the peak that we have every winter, mostly due to flu. So as we are not going to have the flu, I bet that this peak we will not have now. Now, this is 2017, 18, 19. And this is March 2020. So what did we have in March 2020? Obviously, huge amount of use of azithromycin, huge amount of use of antibiotics, not only these antibiotics, colistin, linezolid, ceftazobactam, ceftaroline, doxycycline, absolutely in the records of use ever in history. But I agree, we don't know what the effects on antimicrobial resistance, because on the other hand, primary medical doctors nearly don't work at all. People were stayed at home. We implemented infection control measures in hospitals. So we will see if there's really a more antibiotic resistant bacteria or less. Everything can be. This is the nice thing of life in terms of research. So my opinion is that One Health, we all agree. For me, One Health is a conceptual firmness. So we agree, but it's an operational uncertainty. So we still don't know really how to manage it. And with that, I wanted to thank you for your attention. I wanted to thank the Federation of European Academies of Medicine for letting me share with you this minutes, 12 minutes. Frank, I did my best. And thank you for your attention. And whatever you need, I'm there for you. Thanks.
Thank you very much, Bruno. It was so interesting. I listened in, but I'm desperately short of time now, so I just make it very brief. And I now give the floor to Rens van Dobbenberg from the Veterinary Surgeons Organization, and I ask you to conclude. For me, it was very, very interesting. CPME thanks all the other organizers, and of course, I would like to thank the participants, both speakers and listeners. And Rens, you now have the final floor. I have to say goodbye already, but don't worry, I think you'll manage. Thank you very much, Rens. You have the floor.
Thank you, Frank. I'll give a short wrap up. Well, dear colleagues and colleagues, in the context of today, is a word which has a special meaning, because today it addresses dentists, medical doctors, pharmacists, veterinarians, paraprofessionals, and a lot more. Every health professional delivering an integrated, holistic view on health in general. I think we are looking back to a very successful debate today. Remember, previous time we met in Paris and Warsaw, traveling still was a normal thing to do. Can you still remember? We focused then on how to organize undergraduate training. We debated a lot with student organizations, the guys who will take over after us and have the mission of driving One Health interprofessional education and training. If we do well, maybe they even can skip the adjective inter. Today, our discussions and presentations were more dedicated to postgraduate training. The aim was to explore how training of health professionals can promote One Health practice. And we have seen a few things. We do need to increase interprofessional collaboration. Must do. Professional education and training can support us towards that direction, can help. Universities and educators have started to work towards that direction. Today we heard about 1 week in the last year on AMR. Service learning, new word for me, I don't know for you. Legislation, however, is so far not yet supporting this model of education adequately. Should come. Aim of the European Commission to go the same way. Recently, and Frank already mentioned that in his opening words, recently the Commission chair, Ursula von der Leyen, a doctor herself, announced the start of building a European Health Union, wherein the value of the One Health concept is recognized. We do need a stronger crisis preparedness and a better coordinated response for Europe. The current COVID pandemic only has stressed the need for these. And as part of the package of measures to expect, a new regulation on serious cross-border threats to health is foreseen. It will strengthen the position of EU agencies like EMA, ECDC, and then equipped with sufficient resources. That's important. We strongly welcome that and highlight the need for true One Health approach in practice. With an eye on the regulators that have joined us today, thank you for doing that, I would like to urge you all to take action on and support interprofessional education for all health professionals. Support One Health. Dear colleagues, this debate comes to an end. I feel sure more will follow over time, and I hope in person. Looking forward to close the next one, having a glass beer together. I'd like to thank the people who actually organized this event, Daniela Timus of CED, Mirjam D'Ambrosio, Annabel Seebohm, and Piotr Kozinski of CPME, Despinia Tritu of FE, our student colleagues Alexandra Argodoulakis, Europeanly yours, that word I learned yesterday from her, of EMSA, and Miro Knoops of IVSA. I want to thank the speakers, the moderator, and our audience. Sharing our knowledge and opinions today already is part of the One Health approach. Let's proceed this way. Thank you very much for your attention, and thank you very much for joining.
Thank you.